I get asked all the time whether an individual should get the vaccine or not. Um, and some people just say to me, I'm not getting it because it's not out long enough. And I say, as a scientist, as a physician, the way I approach decision making for myself, for my family, for my patients is a risk benefit ratio. And what we do know is the devastating effects of this virus. So when someone says to me, I don't want to take this vaccine because it hasn't been long enough, so I say, let's do a risk benefit ratio. So you're willing to risk getting a devastating illness such as COVID-19, knowing that there's cardiac manifestations, immune dysregulation, heart attacks after 2 months post-COVID. Some people still, months later, don't have their sense of smell, their sense of taste, fluctuation in how they're feeling, loss of ability to process. People are retiring because they simply can't process the material at work that's being given to them, brain fog, dementia, increased allergies, increased GI symptoms, diarrhea, loss of appetite. I can go on and on and on and give you a laundry list of all the devastating consequences of this virus. So when someone says to me, I don't want to take the vaccine because it hasn't been out long enough, my answer is, so you're willing to put yourself at risk for getting this COVID-19 virus that can kill 1 in 200 individuals. And that if you're over 70 years of age, there's a 13% mortality rate. And if you're not one of those individuals who have passed, but you've had the illness, the long haulers will testify that it is a vicious virus. And we have post-COVID clinics all over the United States because individuals just are not back to baseline. And the physical consequences are causing psychological consequences. So there's depression, there's anxiety, there's a whole host of mental health issues as a result of what is going on with my body. I don't understand. I was a perfectly healthy person, no heart conditions whatsoever. And now I'm 2 months post-COVID and I had a heart attack. That's really, really difficult. So when someone says, I don't want to take it because it hasn't been out long enough, I'd say do a risk benefit ratio. You know that this virus is deadly, that this virus can cause a tremendous amount of damage, and we don't know the long-term side effects of this virus. If those who got it in March are still not the same now in December, are they going to permanently be that way? I don't know.